I use my WaterLase every day. It helps me to put a finishing touch on almost everything that I do.
I use it every single day.
I use lasers in my everyday practice on virtually every single patient.
Patient doesn't know that there was such a different procedure there, but I know that we've done the best work that we can do.
I find its utility to be endless.
Every procedure, probably 10 times a day.
We are a specialty practice. We only perform root canal therapy. We use lasers on every patient.
Had a lady, Jamie, came in. She was a hairdresser. So scared. She spent 30 minutes talking to the front desk about how scared she was. Brought her back, did our thing. She spent another hour talking to our receptionist about how great it was.
The procedures are faster, they're easier, there's less discomfort, there's less swelling, there's less post-operative problems. It's great for patients.
We do a lot of treatments for pulpotomies. Actually, the first time I did a pulpotomy without anesthesia, I was thrilled. I was so happy, and the kids didn't cry. Give them toy, they just loved it.
We're doing the best work that we can do for the patient, and it saves them many times time and money as well.
We can do all of their restorations at once, the whole mouth if they need to, without getting them numb everywhere. It's pretty easy on kids.
Patients really like the idea that you can do a lot of procedures without any injections and without numbness afterwards.
Well, I've had the laser used on me, so I know that you don't need local anesthesia.
WaterLase changed the experience because we can do no shots. We take away the anxiety, the fear.
I'm very much a believer.
I think it bridges the gap for the parents to see their children have such an incredible experience.
I did a maxillary labial frenectomy, and the patient came back for a post-operative check, and the mother said she has no idea how lucky she is because I had my maxillary frenectomy done the old-fashioned way, and she had no discomfort. She went out and ate, and it's just been very easy for her.
We get people from 30 miles away traveling. I always ask them, why are you here? Usually they say, laser.
Some general dentists are sending me patients for consultation because they realize that I might be able to offer the child a better experience, and have ended up doing treatment because I can incorporate the laser technology.
It excites me, and when it excites me, it excites my office and excites our patients. We get returns on that by referrals.
We don't even do any external marketing. All of ours is word of mouth through basically the tool that I have, which is the WaterLase.
I had a patient named Verna. She had irregular gum line, overlapping, crowded teeth. No shots, no pain. We did gum line work, contouring with the handpiece on her teeth. 1 week later, she came back wearing makeup, lipstick, looking good, smiling. So happy, different person, different person.
When I went to dental school, everything was done with a blade, so I know firsthand the swelling, the bleeding, the discomfort that patients have when you use a blade for procedures such as frenectomies, gingivectomies, operculectomies, biopsies. Now with the lasers, there's much, much less bleeding, less need for local anesthesia. They heal more quickly, there's less swelling, and less need for post-operative analgesics.
I never used to do frenectomies in 30 years of practice, and now it's become a commonplace part of our practice, and with great results.
Things that I did in the past where I was doing maybe a class 5 restoration where there was soft tissue that was overgrown and hypertrophied into the cavity prep, I'm able to take my laser and basically do a soft tissue gingivectomy and then step right to the hard tissue prep and treat both, and not only with speed but also with a lot less pain and a lot more efficiency.
I used to send a lot of frenectomies and gingivectomies to the periodontists and the oral surgeons because I didn't want the kids to come back and hate me.
We can do new procedures that we weren't doing before because I didn't know how, I didn't want to do these procedures that we refer out, frenectomies, soft tissue things.
It's exploded our patient population in the pediatric realm.
Many of them refer their own patients to their friends and family to us. And literally, we probably get about 30 to 40 new patients a month.
People would come from the oral surgeon's office, and we would unscrew the healing cap, and there'd be tissue in the way, wouldn't be able to take our impressions. We'd have to close it up, send it back to the oral surgeon, have them clean up. Today, take out the laser, clean up that tissue, take our impressions, build our emergence profile in a much better manner, and again, saves time, doing better dentistry, and that's really what it's all about.
Instead of a 40-minute appointment, it's a 10-minute appointment.
BIOLASE as a company to work with has been nothing short of phenomenal. Their technical support is second to none. Anytime you have questions, there's always someone there to answer. Their on-site training has been fantastic. Whenever we've had any kind of technical issues or service issues, they're Johnny on the spot, get things taken care of, ship things out immediately, no questions asked, just get the job done.
I love the fact that they continue to do continuing education, that they continue to have new products available, the MD and then the gold handpiece and then the turbo handpiece and then the WaterLase and now the new BIOLASE. It makes you believe that the company's going to be around for a long time and that they are on the cutting edge.
We had a year-end meeting with the staff, and we were like, okay, tell us 5 things of the practice that you like. Okay, so this is employees. And the one thing is the high level of patient care, and the second thing was technology. So it's really improved everybody's feeling about the practice because they know that we're practicing at a higher level than we would if we just, if all you've got's a hammer, everything looks like a nail. So this really opens things up.